was telling Jacob and Jared before we came on this morning, my ratings plummeted last month due to these guys not being able to make the trip over to TV 47, but they have made it this morning. Gentlemen, good Monday morning to you.
Good morning.
Good to be back in the saddle. We feel bad about what happened.
Between y'all not being here and COVID and all this kind of stuff, what a year we faced.
We brought it. We were the new low.
Yeah. I did get my flu shot, though.
That's fantastic.
And you're still alive.
Yeah, y'all weren't there.
Now, this is the election edition of the program, right?
Oh, yeah. Yeah, it is. It is.
Just kidding. Better not talk about that.
What is Medicare Part D? What is this? I thought it's A, B, and C.
Well, it is time. First of all, it is time for open enrollment. We'll get to that in just a second. Medicare Part D, just for a refresher. Look, to get to the changes for 2021, we got to make sure we have a refresher for some of these terms and definitions.
I can't believe there's changes.
So, yeah. and surprise, surprise, the costs are going up. Yeah, no. I know it's difficult to believe. Medicare Part D is just a way of talking about the drug plans, right? You've got Medicare Part A, which is your hospital insurance, Medicare Part B, which is your doctor insurance, along with lab tests and diagnostic tests, and Medicare Part D, which are your drug plans. So those are kind of the way things break down.
Jacob, so a lot of people on this type coverage?
Or some version of it. I don't know what percentage of our population in America is 65 and over. I know it's a significant population. I know the population of our general area tends that direction as well. And so, yeah, everybody 65 and over or under 65, but on Medicare for disability purposes falls into this realm.
Open enrollment going on now.
Open enrollment's going on now. Started October the 15th, ends on December the 7th. So we still have plenty of time to help you look at what plan you're on now, or if you're turning 65, say in January or February, plenty of time to look at what will be your first Medicare Part D plan. But we do need to get the ball rolling if you need help with that, in the next week or so.
What's some of the differences, Jacob?
Well, the probably two biggest categories we ask people to be aware of is you can choose a Part D plan, which is drugs only. You keep your Medicare A for the hospital and doctor, B for the other stuff, D for drugs only. Or you can choose what is called a Medicare Advantage plan, which at that point you go solely on to this new plan. You'll have one card that's your doctor, hospital, pharmacy, lab, whatever. Some even have dental benefits and things like that mixed within it. And so for roughly the same premium as you could have your Part D plan, for the same drug premium you could have an Advantage plan as well, and just trades out some of your benefits from Medicare proper to this new company.
Now, there's a lot of companies offering this. I get stuff in my mailbox nearly every day, 2 or 3 pieces of mail about it.
You mean you're over 65?
Well, I don't look it, but I am.
Well, there are, as Jacob said, the two big categories are drug plans only, Part D, and then Advantage plans, which combine everything into one. There are probably 25 or so drug only plans, and then there are another 8 to 10 Medicare Advantage plans. So the choices are numerous.
And confusing.
It obviously gets to be confusing. So you need help, and of course we're here to give you any advice on this.
So they just contact you guys? Is that how it works?
Yes. I guess it's probably good to emphasize that the answer is not instantaneous if you want a good answer. Good answers take time because everybody has a different list of drugs they take, and we're going to take that list of drugs and go to the 30 to 40 available lists of covered drugs and copays that are available and find out which one matches up best for you. Mm-hmm. And so it's not, let me walk in the farm and say, hey guys, what's a good plan this year? That happens 20 times a day. Hey,
if somebody answers a question like that, it's not a good answer.
Yeah, if someone answers that, that's not in your best interest, I can assure you. Hey, what's a good plan this year? What's your favorite plan? Well, it's different every year for every single person. Well, I've been on this plan for the last 10 years. Shouldn't I just stay? Not necessarily. They change their list too. And so it's individualized. So the process is come in or call. Hey, I want you guys to help me pick a plan. Great. I think that's a good idea to let us help you pick. We'll put your name on the list. Contact us back in X amount of time. We'll tell you and we'll have an answer for you.
A number of people take many different medications that'll fill up a Dollar General bag. And so, we got to be careful here.
Yeah, like my parents take a whole bunch of medicine. There are a lot of our patients take a whole bunch of medicine. We also have plenty of patients over age 65 that take maybe one medication, maybe two. Sometimes those medicines are very inexpensive. So the answers for those two different types of groups are going to be significantly different. If you do not have any very expensive brand name drugs, then you're going to be able to get away with a plan that doesn't cost very much money per month, probably has some pretty low co-pays for your generics. Once you start getting into these brand name drugs that cost a whole lot of money though, it becomes very important for you to do a serious comparison of plans in order to make sure that you're not paying more money than you have to.
Jacob, explain what is the description of coverage gap. What is this?
The most confusing thing that our legislature ever put before us. And this has been around since 2006 when Medicare came in. So it's been out there for a while, but for easy purposes, there are 4 parts of the year, 4 sections, 4 phases. Depending on how I think phase is the one our government uses. Phase 1 every year is your deductible phase, which means you're paying all of it pretty much. And this year, the standard deductible is going to be for coming up year. It's going to be $445.
So
up to
what
$10.
months is that?
It's until you pay it.
Okay.
Yeah.
Until you accumulate.
Some people come in on January 2nd and get a $500 brand name. They pay $445 for it, and their deductible's met. Some people in October still hadn't met it. Okay, so deductible phase is phase 1. Phase 2 is just your regular phase. Like when they say this is going to be your copay for brand and generic, I mean that's what you're going to be paying, right? What the book says. Phase 3, however, is the coverage gap and or donut hole, depending on how you want to call it. But that's where you pay more for your medicines. When you've paid in between you and the plan a total of $4,130 this coming up year, you go into the coverage gap. And so instead of your $10 copay and your $25 copay, you're paying percentages now. 25% of the total cost on brands and generics, which I can assure you is higher than the copays you were paying before. And so it costs you more up until you spend goes up to about $6,500 and change. And then you go into phase 4. It's confusing, right? Phase 4, catastrophic phase, where you pay significantly less than you were at any point in the year. They say at that point they've already hit you enough. You've already spent enough. You pay significantly less from that point on until December 31st. And so if that sounds confusing, it's because it is.
That's right.
We touched on it briefly, but let's go in depth about major changes that are taking place.
Yeah, I'll tell you, let me back up first and define, let me define preferred networks for you, because this is going to go into the biggest changes for this year, particularly if you're a patient of Marble City Pharmacy or another privately owned pharmacy like ours, okay? Preferred networks, when you get your plan data, you get the yearly summary sheet. It will tell you these will be your copays these will be your cost sharing or your copays at a standard network pharmacy. And these will be your copays or cost sharing at a preferred network pharmacy. What that means is there is a price you might pay at a standard pharmacy, and then a preferred pharmacy that has basically a better contract or a special contract with that particular drug plan. You're going to pay a lower price, okay? So we do participate in multiple preferred networks. One of the ones that we have participated in ever since the beginning of its existence were these plans called SilverScript and WellCare. They're owned by the same pharmacy benefit manager, not to get too technical about that, but they're owned by the same company. We have tons and tons of patients on SilverScript and WellCare. Up until now, we have been in their preferred network. Beginning January the 1st, we're not going to be in their preferred network because they didn't offer it to us. And if you opt to stay on SilverScript or WellCare in 2021, you're going to have to pay slightly more for your medicine at our pharmacy or a small privately owned pharmacy like ours than you will at some of the big national chains. Now, before you panic about that, yes, there is something you need to do, but before you panic, there are other plans available that cost a similar amount per month in premium, with similar medication copays that you can swap to if you choose to. So do not panic. Just understand, though, that if you are on SilverScript or WellCare and you do nothing, it will cost you slightly more to continue to use our pharmacy or one like ours.
Jacob, what goes into decisions to you either are or you're not?
Honestly, when this okay, boy, I gotta
careful
tread
with this.
lightly. I don't know if we have legal counsel present. When this program started, it was simply along the lines of the plans would offer to pretty much every group, if you want to be in our preferred network or not, you will agree to take a slightly lower reimbursement for people getting medicines at your pharmacy in exchange for us driving them to your pharmacy and then paying lower copays. It was a quid pro quo. There's your Latin for today. However, now it's more the plan choosing who they're going to offer that to, period. And a lot of times they try to keep that as close to the vest in terms of pharmacies they have an affiliation with as possible. But yeah, it's basically, the plan now has the choice of who they're going to offer the preferred network to or not. But that's probably is let's go with that summation.
I think we need to stop that right there.
Yeah.
That's correct.
Yeah, let's leave it at that.
Honestly, being a client of you guys, it seems a little unfair that the person that works with you guys, that you help with their prescriptions every month, and as we get older in life, it seems like, well, there's enough confusion as there is. Now, I want you to re-emphasize, Jared, about people watching the show this morning. They said, oh my goodness, there's something happening. I can't get this done.
Sure. If you are one of the types of people like myself who prefers to take mail and throw it directly in the trash, then you may have ignored your letter from, for example, SilverScript or WellCare that says plainly, if you stay at Marble City, you're going to pay more next year. Again, do not panic. We have time. There are alternatives that are available for you should you choose to swap. Now, let me tell you this. If you just happen to be a person who's in love with your current plan, you simply don't want to change to another plan, and it's more important for you to keep that plan than to use Marble City Pharmacy, then that's fine. There's no hurt feelings. Of course we want to keep you, and of course we want to offer you alternatives to stay with us, and we can do so without you having to spend gobs of more money to stay with us. So we do have time. But we do need you to go ahead and contact us because, quite frankly, I'm working through a list right now of 2 or 3 pages on a legal pad of people that we're trying to help. So we need to go ahead and get your name on that list if you're watching the show today and you need help.
And Jacob, we are a family community here. We don't like change. We don't like people messing with us,
I hope it's universally true that people don't like change that much. I hope that's generally true for everybody. I know it's true for everybody in this room. And so when these changes come about, what we have to do is find the best way to work around them. And again, that's where we come in. We don't expect you, the audience, to know how to work around this. It is extremely confusing. That's where we come in. Let us help you work around it.
Other changes?
Underwear. No, sorry. I'm sorry. What?
Monthly, whether needed or not.
I wasn't in
Anything else left on the page? Okay, all right.
We'll be back after that.
No, I don't think. I think we probably discussed everything. The monthly premiums, honestly, which all that means is how much do you pay Medicare for the drug plan each year? They're actually very similar. They range from probably $25 up to $100. Most of those plans that are more expensive, honestly, are not worth the cost. You can pay a significant amount of money per month and avoid the $445 deductible, but quite frankly, the difference in the premium is so much, it'll cost you way more than $445 for the year. So before you go diving into a plan with no deductible because you just really want to avoid the deductible so bad, consider how much more you're going to have to pay per month over 12 months. Okay, so there's a lot of math involved. We got calculators for that kind of stuff. That way Jacob doesn't have to do it off the top of his head.
Yeah, and really, let's just talk.
Yeah.
Oh, sure.
Let's come into the store.
That's the answer to most problems. That's the answer to most problems.
Yeah. All right. Appreciate you both being here this morning. Medicare Part D, 2021 changes. And if you're not confused by now, I've got 30 more minutes to go on this show. So appreciate you guys joining us today.
That's great. Thanks a lot.
Sir.
More day break right after this.